Hi, I'm Scott Williams, Vice President for Men's Health Network. Today I'm discussing important issues in men's health. Your body needs regular checkups and repairs just like your car. For instance, you wouldn't go a year without checking your oil, so why do men tend to go several years between regular checkups and physicals?
Men need to be more connected to the healthcare system, and it needs to begin at an early age, even in the late teens. When a man has not seen a doctor in decades and comes in because he's feeling ill, it may be a very advanced disease process by that time. Their prognosis isn't as good as it would be if that problem was picked up early.
Regular maintenance can prevent bigger problems down the road. If you catch your blood pressure while it's just slightly high, you may be able to easily bring it down to normal with diet and exercise, instead of waiting for it to go sky high or even cause a heart attack. In their 20s, men tend to ignore aches and pains and play through their injuries because of an indestructible mentality. In their 30s, they're focused on progressing with career and family. By the time they're in their 40s, they don't go because they're afraid of what they'll find out.
Men often avoid doctors because they're taught to soldier pain. So when he's 50 having chest pain, he says it's just indigestion because he's been socialized to believe if he just ignores it, it'll go away. So men need to recognize that pain is telling you that something is wrong and needs to be corrected.
So what regular screenings and checkups should men be getting? At the very least, all adult men should have their blood pressure, cholesterol, and glucose levels checked every year and receive a thorough physical exam every 1 to 2 years. Of course, your age will also impact additional screenings that you may want to get. For instance, beginning in the teenage years, men should perform regular testicular self-exams to detect lumps or anything else suspicious. Testicular cancer is most common in men ages 15 to 35, but can happen at any age. Beginning at age 40 or even earlier if you're African American or have a family history, men should get a prostate-specific antigen or PSA, which is a simple blood test, and a digital rectal exam as a baseline for your individual risk of developing prostate cancer. You should speak to your physician about the need for annual screenings.
Men need to realize that being sick or seeing a doctor is not a sign of weakness, that the illness is the true enemy of manhood. Your healthcare practitioner is your ally and your friend in helping you be the best man that you can be.
Now, for everyone's favorite topic, sex. If you're sexually active, it's important to be checked regularly for sexually transmitted diseases or infections. You can lower your risk by wearing a condom, but in order to best protect yourself and your partners, regular testing is recommended. All adults over the age of 50 are at risk for colorectal cancer and should get a colonoscopy every 10 years. And don't forget your tetanus booster every 10 years as well. Speak to your physician about further screenings that might be appropriate. Let me tell you a little bit about myself. I'm Vice President for Men's Health Network, an organization dedicated to reaching men and their families where they live, work, play, and pray with health information, screenings, and education. I'm also founding chair of the American Public Health Association's Men's Health Caucus. As a men's health advocate, my goal is to make sure that all men seek preventative health care, know their risk, and lead healthy lifestyles for themselves and their families. If you want to learn more, check out other videos on men's health, including what questions you should ask your doctor.